Cardon Children's Medical Center, providing comprehensive pediatric care for Arizona's families.
Lauren would fall asleep on the kitchen table during her schooling right after breakfast or during breakfast. She would just lay her head on the table and she would just be so tired. And I know she gets 11 hours sleep at night. So I knew that couldn't be the problem.
Excessive daytime sleepiness is something that shows up a lot different in adults than it does in kids. When I'm tired, I get sleepy and I want to rest. When kids get tired, they get active, they get hyperactive. So many times they may be, acting up in school, not paying attention, their grades may be suffering.
I am so grateful to be able to homeschool them. Being home with her all day, because I think about that. If she was at school, would they notice that? Why is this 11-year-old girl so tired? It's just, it didn't make sense to me.
Any patient that ends up coming to the sleep center has identified that they or their child or a sibling or relative, whoever, has a sleep issue, whether they're tired throughout the day, they're snoring at night, they're tossing and turning, just something that's just not normal, and they're not feeling normal. They may recognize that, may bring it up to their physician upon a visit to the pediatrician or their primary care.
They already have a pulmonologist for their asthma, and I happened to mention to him at one of the follow-up visits, and that's when he had suggested that it could be sleep apnea.
Once it's identified that, hey, there might be some kind of an issue, the doctor will recommend they come in for a sleep study. They arrive here at 7 p.m. or 8 p.m. actually, that's our appointments, and they just stay the night. Before we get started running any of this equipment back here, we actually put some wires on the child's head and face, and also what we're watching for is we're watching their brain waves throughout the night. Watching for any muscle movement, and then also we put some electrodes on to watch their heart throughout the night as well, and then some on their legs to see if they move their legs throughout the night. So you've heard, I'm sure, restless leg syndrome, and throughout the night it's called periodic limb movement disorder. And then one of the biggest ones is the respiratory. We watch respiratory throughout the night, and we put a couple belts on, one on the chest, one on the abdomen. Little small belts, real light, real easy to lay with. And they stretch and they move along with you. And then also a little, like when you see somebody that has oxygen, a little sensor underneath their nose. That little sensor determines how much air they're breathing in and out, and if there's any issues with their airway, if they're not breathing in and out. So we're looking for apnea. It helps us identify apnea. All these sensors, they are tethered up to a nice little rope style and kind of draped off to the side. So when the patient actually lays down, they're not laying in a big pile of wires. They're laying in something that's actually not that uncomfortable at all compared to what it looks like. It looks like it's not going to be comfortable at all. But so many of our patients lay down and say, I didn't even feel the wires the rest of the night. So that was actually a lot easier than I thought it was going to be. Okay? Have a good night. Throughout the night, we do the acquisition and determine what's going on with their sleep, and the technologists review it throughout the entire night, giving every 30 seconds of that time that they're in bed, they determine what stage of sleep they're in, if they're awake, if they're asleep, and what stage of sleep they're in. And then they go back through and mark anything that they see, if they have any apneas, if they wake up throughout the night, if they're kicking their legs, anything at all, they mark.
She had snoring, and they again brought her in here, found out she did have sleep apnea, and took her to the NT as well. No obstruction, and she is on CPAP currently, and she is doing great.
Well, what CPAP does is actually, as that airway goes down, you breathe against that, it creates a splint in your airway, in a sense. Kind of like the air inside of a balloon pressing on the walls. Pushes them out and holds them out. So as you sleep and relax, instead of your airway relaxed and closed, it rides on a nice cushion of air and stays open. Breathing in and out the way you should, and you're not waking up throughout the night, you're going to feel a lot more rested.
Her learning is better. She's not upset so much about wanting to learn because she's not tired now. And now it's just her normal day now, and now she likes to go and play in the park and, you know, just be a normal 11-year-old girl.
The parents, after you talk to them after this is all done, or maybe they come back in for a follow-up study, say, wow, you know, it's a significant improvement around the home. Our grades are up, and they're feeling better altogether.